capstone project for my adult nurse practitioner that covers correct inhaler technique and spacer use. This video will cover how to use Spiriva, Floridel, Advair, and Albuterol, and some key information about all the inhalers. And also the option of using a spacer will be covered. First we will start with Spiriva. Spiriva is a dry powder inhaler that is a long-acting anticholinergic, which means it inhibits smooth muscles in the lungs, causing bronchodilation. It improves lung function for 24 hours. The adult dosing for Spiriva is 2 inhalations daily at the same time every day. It is a maintenance medication for COPD, not a rescue inhaler. It is important to remember to take 2 inhalations at the same time every day, no matter how you feel. Now we'll start with the actual directions of the inhaler. This is what a Spiriva looks like. First, you would open up the top, okay? And once you're ready for the inhalation for the day, you'll get the capsule ready. Do not open the capsule until you are ready for use. Peel the corner back and get the capsule out. Be careful not to harm the capsule while getting it out. Next, open up the mouthpiece and place the capsule inside. Then you'll close the mouthpiece, you'll hear a click, and then you'll press the button on the side until it's flush. Only push once, the green button. When you're ready for the inhalation, fully exhale first, and then place the mouthpiece in your mouth and take slow, deep breath and hold for at least 10 seconds, or as long as it's comfortable for you. Once you are done, you'll take the empty capsule out and throw it away. Never leave an empty capsule in the Spiriva chamber. Cleaning information for Spiriva is it needs to be cleaned monthly and left to air dry for 24 hours when your next inhalation is due. Just simply warm water into the top, clean out the mouthpiece. You will pull up on the green part here to clean the bottom, and you'll just leave it on your counter, open to dry for 24 hours. Alright. Key information about Spiriva is do not swallow the capsule. Only open the capsule when ready to use. Inhale twice to get all the medication out of the capsule. When you take the capsule out, you'll notice that it's empty and you've used all the medication in it. Store it away from heat and cold, and let your doctor know if you are pregnant, breastfeeding, have glaucoma, kidney problems, or trouble passing urine. A different medication may be prescribed in those situations. The website for more information is www.spiriva.com. The next inhaler we will cover is Floridel. Floridel is also a dry powder inhaler with a long-acting bronchodilator. Therefore, it opens up the airway, decreases wheezing and shortness of breath in COPD patients. The adult dosing for Floridel is 1 to 2 inhalations twice a day for maintenance therapy for COPD. It needs to be 12 hours apart, and it is not a rescue inhaler. Inhaler directions for Floridel. First, you'll take the cap off, okay? And you'll see the mouthpiece here. Hold the base, and then go clockwise to open. Then you need to open up your capsule. Do not peel back the capsule until you're ready for use. Take the capsule out, place it into the base, like so, and then close the mouthpiece. And then you'll click. Then you'll press the buttons on each side in order to pierce the capsule. Push them only once to pierce the capsule. Then you will slowly exhale, get all your air out, place the mouthpiece in your mouth. You'll hear the capsule going inside, and then you will do it again to make sure that all medication out of the capsule is gone. It's important to hold your breath for at least 10 seconds in order to get all of the medication out of it. Remember that once you are done, it is important to pull the capsule out. Do not leave an empty capsule inside. Close it back up, put the cap back on. cleaning information on a Floridel is never clean it. Never get it wet. Key information about Floridel inhaler is it expires 4 months after starting use. Also check the date on the actual box. Do not swallow the capsule. Only open the capsule when ready to use, 1 capsule at a time. When you're done with the 2 inhalations, make sure the medication in the capsule is empty. Do not exhale into the device with the possibility that it would get wet. Avoid getting any parts wet. Store away from heat and cold. And the important thing is 2 inhalations twice a day for maintenance. The website for Floridel is www.floridel.com. The next inhaler we will cover is the Advair Discus. The demo is brown. The actual discus is purple, so don't be confused by that. Okay. It is a dry powder inhaler that is a combination of an anti-inflammatory and a long-acting bronchodilator. It improves lung function in COPD patients. The adult dosing for Advair is 1 spray twice a day for maintenance therapy for COPD. It's a maintenance drug, not a rescue drug. The directions for inhaler use on an Advair is pull the inhaler and push the thumb grip to the right, and you will hear a click. You will also notice there's a counter on the Advair inhaler, and it'll go down by 1 once you have got the dose prepared. Again, you will exhale fully, place the mouthpiece in your mouth, and fully and deeply breathe in as long as possible for at least 10 seconds or as long as you can handle. Close the inhaler by using the same lever on the right, and that is close the inhaler. Pretty easy little thing. Every 12 hours. Never clean the inhaler like the Floridel. Key information with the Advair is use the inhaler on a horizontal position, not up and down. Always rinse and spit your mouth warm water after each use to avoid any oral infections. Never take an extra dose. Keep away from heat and cold. Discard after 1 month or when the counter reads 0, whichever comes first. And do not exhale into the inhaler. Like the Floridel, to exhale into the inhaler would possibly cause some moisture, which could interfere with the dry powder. For any information about Advair, go to www.advair.com. The last inhaler we will discuss is the albuterol inhaler, which is a pressurized meter dose inhaler that is a short-acting bronchodilator that relaxes the smooth muscles in your lungs. The adult dosing is 2 inhalations every 4 to 6 hours as needed for a rescue situation in COPD patients. Remember, this is a rescue inhaler. Let your doctor know how often you're using it. If you feel like there's an increase in the amount, let them know. In order to use a albuterol inhaler, which is a pressurized dose, you remove the cap first, place it to the side. Then you will shake it 4 to 5 times vigorously. If it has been, it's your first time using it, you need to prime it with 3 sprays. Or if it's been 2 weeks, 3 sprays. Again, you exhale away from the inhaler fully, and then place the mouthpiece in your mouth. Press the canister down the same time you inhale, and hold your breath for 10 seconds or as long as possible. It's important to take in a slow, deep breath at the exact same time you're pressing down the canister. Wait 1 minute until your next inhalation, and again, shake the canister 4 to 5 times. Replace the cap. Remember to clean your inhaler weekly with the canister out and allow to air dry. This just pops out. You wash this whole piece and let it air dry. When you're ready to reuse, canister back in, put the cap back on. Key information is keep the inhaler at room temperature. Throw away after 200 sprays or 2 months. Watch for any respiratory change. let the doctor know if you're using more often than you're used to, and then a change may be needed on your other medications. The website for more information about albuterol is www.proairhfa.com. After the inhaler conversation with the techniques of using those 4 inhalers, we'll also discuss the spacer use. A spacer you can get from your doctor or pharmacy. It is used with the albuterol or any pressure dose, meter dose inhalers, the ones that have the pressurized, not the dry air, to reduce side effects and deliver more medication effectively and get to your lungs and set up in your mouth. A lot of times when you're using the meter dose inhaler, it gets stuck in your mouth, throat, and it needs to get to your lungs. The hand-eye coordination with the pressure dose inhaler is kind of hard for older patients, so a spacer would be totally recommended for an elderly patient. I do not have the actual spacer, but you can use your own handmade one, paper, and you would take the cap off of your albuterol inhaler, pull the spacer onto the mouthpiece of your inhaler, and then put your mouth on the end of the spacer and push the canister down and then breathe in as long as possible. Then you would wait your 1 minute and then do it again. The spacer allows the medication to be held in the canister longer, allowing the patient to get more medication. Repeat in 1 minute if needed. Key information about spacers is that it increases the amount of medication to your lungs, it decreases the need for more medication, and allows more time for the patient to inhale the medication. There are several different kinds of spacers. There's a longer one, there's shorter ones. A disadvantage to a spacer, a patient would say, is it is not as easy to carry around. They like their meter dose inhaler because you just put it in your purse and go, and then your spacer is kind of big, but they have the smaller ones, whichever you need to consider for yourself and your own lifestyle. That concludes my inhaler technique video and my spacer use. Just important things to remember is that the first 3 medications and inhalers I mentioned were maintenance medications, and follow your doctor's orders on those. And then your albuterol is your only rescue inhaler that you would use more often as needed for shortness of breath. Dr. Lackey will be out there to help you with any more questions, and specialty care associates will be helpful in all your needs. Thank you very much.
Hello.